gosh. Hi.
Good morning.
Good morning.
It's morning here.
It is for now. 5-minute chat.
What are we talking about today?
It is Valentine's week over here at Reconnect Health, and so we want to talk about some heart health, maybe a little bone health if we feel like we're up for it.
It's my birth week too. Like I gave birth this week.
Hey, happy birthing days.
Today is my birthday day.
I feel like maybe mothers should receive presents
Eric,
on
are you listening?
birthing days. Okay, heart health. So we want to talk about heart health because there really is kind of a women's health tone to it, and we certainly see that women tend to be at a slightly lower risk of heart issues, so stroke, heart attack, other types of like arterial or vessel disease until menopause. And then menopause happens and we are right in line with men. However, there's less research on female presenting symptoms, and I think there's less public awareness about that as well.
Let's talk about symptoms.
Okay. So classic heart attack symptoms are chest,
pain,
left
shoulder,
arm, pressure feeling in the chest.
Yeah.
And you can have that certainly with women that are having signs of heart attack as well. But I think it's somewhere around only 40 to 50% of women actually present with those symptoms. I could be wrong, but it's somewhere around there. So what are the other symptoms that they will feel? So nausea and vomiting is one. Fatigue. Fatigue. We're always tired. So that's difficult as well. Jaw, upper back.
Yeah.
Women will report a weird feeling in their chest.
Anxiety.
Yeah.
When I did a rotation in cardiac rehab when I was a student, and almost every woman told me they felt very like off that day. Like they almost felt like they were having an anxiety attack, or like that same feeling they got with being worried or stressed.
Yeah.
They had that same kind of sensation.
Yeah. And so I think what happens is that sometimes women won't recognize these symptoms straight away, and so they might delay going to seek medical care. But oftentimes, even once they present to medical care, sometimes it is dismissed as menopause symptoms, as an anxiety attack. And so we see women that are even doing the right thing and then sometimes missing out on the care that they should be provided with.
Yeah, accessing the drug.
So education, I think, is really important for that.
Yes.
The other nice thing is that exercise has been shown to help reduce your risk of having some sort of cardiovascular event as well. So Eryn, exercise maven, why don't you tell us how we should be exercising?
Well, the guidelines say, and there's very good research to support cardiovascular health. And so I want to just like quickly, because some people don't recognize the difference between different types of exercise. So there's cardiovascular exercise, which is like, they call it like large movements of like your skeletal muscles. So think things like running, biking, dancing, cross-country, repetitive movements, Something that's getting your heart rate elevated, because its primary focus is to tax the cardiovascular system to create change and positive outcomes, okay? So 150 minutes of moderate physical activity is what's recommended per week to have those positive outcomes. So like improved cardiovascular health, reduce, like there's so many. I could read them off for 5 minutes, but your cardiovascular risk factors are very positively impacted if you're meeting that 150 minutes of moderate activity or 75 minutes of vigorous activity per week. And one thing I find with my patients, Katie, is when I talk to them about it, they're usually pretty surprised they think they have to exercise really, really hard to meet those guidelines, but that is not the case at all. Right. And so I always give them homework that if you are not on a medication that impacts your resting heart rate or your heart rate response to exercise, so like think beta blockers, sometimes different, like if you have arrhythmias, that can also impact your heart rate, but put a smartwatch on or take your pulse, and I think you'll be very much surprised at how, I don't want to say easy, but it's not, you don't have to be exercising really, really intensely to get into that moderate range.
Yeah.
A walk, going up and down the stairs. I walk down the hallway sometimes when I get into the bottom part of that range. So I think just like give yourself credit sometimes for activities that you might already be doing, and you might be getting in that 150 minute range.
And that's the same thing as 150 minutes. You honestly get to decide how many times a week you want that to be and how long those sessions are. So it might look like 20 minutes every day, but it might look like a much a longer volume fewer times a day, right? So you can change the time length and the frequency based on what works for your schedule, which is nice.
And sometimes resistance training has a different primary focus, which we can talk about in another 5-minute chat. But sometimes if you are doing more like HIIT type training, or you're not taking long rest periods between sets, so if you're not focusing on hypertrophy, which we can talk about that as like growing your muscles, you can also be getting into an aerobic range while you're doing resistance training. So it's kind of like a 2-for-1, depending on what your primary goal is.
Yeah, which is why we're such huge supporters of circuit training, because it gets your strength training in and it gets your cardiovascular training in as well.
2-for-1.
So please look after your heart this Valentine's Day, and you can always ask us questions if you've got any questions about how to check for your heart rate and risk factors for cardiovascular disease. Bye!